You're on.
Hello, this is Dr. Ilya Skolnikov. I want to welcome you to our discussion of the thyroid gland. Very complicated gland, not an easy thing to discuss, but we're going to do a great job and get you all up to date. So, in this country, the United States, there are a lot of people walking around with thyroid dysfunction. It is pretty dramatic. It's actually an epidemic. Okay, so here we have hypothyroidism. I'll be referring to a few different books, kind of keeping you up to date with some of the research and some of the things that are going on regarding the thyroid. This is really important, so please watch the whole video. Please don't stop in the middle. You want to know about this because either you or somebody you know has trouble with their thyroid. Okay, so this book's called, what is it called? Hypothyroidism, Type 2. And that's by Dr. Mark Starr, the medical doctor. He runs a pain clinic somewhere. And here you can see he's calling it the epidemic because that's exactly what it is. A thyroid condition, which we see commonly in this country, is now, or has now become an epidemic. So we're going to review a lot of different things. First of all, let's go to some of the basics. When we're looking at thyroid function, we need to look at everything because everything is related to the thyroid. So there's 4 key areas I want to look at with you today. The first area is blood sugar and the adrenal glands. Okay. So I'm drawing a picture of a teeter-totter. And this teeter-totter has on it 2 glands. We have the thyroid here, and we have the adrenal glands here. Okay, I hope you can see that there in the audience. So the thyroid and the adrenal glands, they work as a teeter-totter. In this particular situation, it looks like the thyroid, this is a person, and this person's thyroid is doing pretty well, but their adrenal glands are suffering. So they actually have a certain body build, this person. They tend to be fairly heavy set, not always, and they tend to have a heavy set build. They might have somewhat of a heavy upper body, and they certainly don't tend to be a thin person. I'm certainly generalizing, but that's what you find with this type of individual here whose thyroid is doing well. And obviously, and their adrenal glands aren't doing well. Let's take that back. With this particular person, if their thyroid is doing great and their adrenal glands aren't doing too well, they tend to have more of a thin type build, muscular but thin, lanky, sinewy type muscles. And so because the thyroid has a lot to do with metabolism, so a person who has a hypothyroid will often be a little overweight. They might have a moon-shaped face. They have a thin lateral 1/3 of the eyebrows are thinning, and they often have a thin upper lip. These are a lot of the aspects that you'll see of somebody who has a hypo-type thyroid. So I just thought I'd share that with you. So we're going to go over that. So anytime we're looking at a thyroid condition, we're looking at the adrenal glands, we're looking at blood sugar, we're looking at anything having to do with the gastrointestinal tract. We're going to go over why that is. We're also focused on immune function and allergies and sensitivities, food sensitivities, for example. And we also want to deal with the liver and because a lot of the thyroid hormone is converted in the liver, and we also want to take a look at essential fatty acid metabolism, because essentially the liver is the main organ of fat metabolism. It's not the only organ, it's the main one. There's the liver, there's the gallbladder, which holds the bile that was made in the liver, and then there's the small intestine where fat is absorbed. And then of course there's the pancreas, which squirts out into the common bile duct a number of different enzymes such as lipase, which helps to break down fat as well and metabolize fat. Okay, so these are all things that a person needs to consider, if they're a healthcare provider at least, when they're treating thyroid dysfunction. So let's not forget about this teeter-totter, because the adrenal glands are what's called the stress glands. They're on top of the kidneys. They're only about 4 to 6 grams each. There's one on each side, on each kidney. The thyroid is a butterfly-shaped gland. Again, the thyroid is a butterfly-shaped gland, and it's right here behind the Adam's apple, also known as the thyroid cartilage. So there's two main functions that the thyroid has. One, it determines the rate of metabolism. It determines how much energy you have or don't have. It's very similar to growth hormone. And that thyroid hormone is called thyroxine, the one that does that. And thyroxine is used in every cell of the body: the hair, the skin, the nails, the muscle tissue, and to some extent the bone as well. Now the other aspect of thyroid metabolism would be calcitonin, made in the same gland. Calcitonin regulates calcium balance. Very important. Calcitonin tends to put calcium into the bone, and parathyroid hormone tends to pull calcium out of the bone. There's also these little there's little glands as well called the parathyroids, and there's about 4 of those, and they're right inside. They're right attached to the thyroid gland, essentially. It's not that they're in the gland, but they're right there on the thyroid gland. So one should consider the whole system when dealing with the thyroid. We're going to go over a lot right now. A thyroid problem is rarely a thyroid problem. A thyroid problem is always some other problem, because the thyroid has to do with the entire body. And prior to right around 1975 or right 1980, the way that they were diagnosing if a person had trouble with their thyroid or not was according to how high or low their cholesterol levels were. Total cholesterol, LDL, HDL, and triglycerides. Nowadays, they don't do that. They don't do that. I don't know why exactly, but there's a lot of strange things happening in healthcare nowadays, and that's one of the many strange things. So I could talk to you about it perhaps in another video, but it's a little strange because it's so valuable to look properly at a lab report to see what's going on. And if you're not trained properly to look at the lab and look at the function of the person's glands and organs, structurally, chemically, and emotionally, to me it just doesn't make sense. So I do have an opinion. I'm not shying away from sharing that with you. I have a strong opinion that healthcare providers today are relying too much on the labs and not enough on their patient feedback and what the patients say and their patient history and just the patient's body, essentially, and the various different indicators that can be found on the body. Okay? So there is a muscle that relates to the thyroid gland. It just so happens on both sides of the body you find the teres minor. The teres minor inserts into the humerus here at the lesser tuberosity, and it originates, it originates at the infraspinatus, it originates at the lateral aspect of the inferior portion of the scapula. Okay, so anyway, that's the scapula. I can't remember the common term for that, but that's the shoulder blade, I guess, is the common term. Okay, so the lower outside border of the shoulder blade, that's where that muscle originates. And